So I'm hopeful that we are on and everyone can see us and hear us. My name is Donna Fagan, and I am a certified family partner I'm a master level certified family partner at a local mental health authority here in Texas. My pronouns are she, her, and hers. I want to give a big thanks to all of you for joining us. We truly hope you find today's presentation engaging and helpful in your work. So we want to give a good disclaimer. This presentation was prepared for the MHTTC network under a cooperative agreement with the Substance Abuse and Mental Health Services Administration, SAMHSA. All material appearing in this presentation, except that taken directly from copyrighted sources, is in public domain and may be reproduced or copied without permission from SAMHSA or other authors. Citation of the source is appreciated. Do not reproduce or distribute this presentation for a fee without specific written authorization from the MHTTC Network Coordinating Office. This presentation will be recorded and posted on our website. At the time of this presentation, Tom Cordier served as SAMHSA Assistant Secretary. The opinions expressed herein are the views of the presenters and do not reflect the official position of the Department of Health and Human Services, DHHS or SAMHSA. No official support or endorsement of DHHS or SAMHSA for the opinions described in this presentation is intended or should be inferred. So let's get started. We have an amazing moderator for today's panel. Her name is Jamie Edwards, and she's the executive director of the Refuge Center of Houston. The Refuge was founded to provide family peer support services, faith-based counseling, and spiritual care and direction. In addition to her work at the Refuge, she also engages the community through blogging, workshops, training, and advocacy services. As the mother of a heroin addict, Jamie knows firsthand the trauma, heartache, shame, and fear that the disease of addiction can generate. Therefore, she strives to provide a voice and a space for families to engage in the recovery process as they seek and strive to recover, rebuild, and be restored. Jamie is also the director of community relations at Archway Academy. Archway is a sober high school in the sunny heart of Houston, Texas. Archway is the nation's largest recovery school in the nation. Jamie has a BS in education and an MA in Christian leadership with an emphasis on family addiction ministry. She is also a certified family recovery coach. Prior to opening the Refuge, Jamie spent 21 years in secondary education. She uses her experience as a former educator to speak on behalf of families and believes education is a powerful component in decreasing the shame and stigma associated with substance use disorder. She has spoken at numerous conferences and symposiums on the role of family recovery and has been interviewed by Fox News on her work with families and as the mother of a person with substance use disorder. So Jamie, thanks for being with us. Thanks to our panel. I'll pass it off to the panelists so you guys can get started.
Thank you so much, Donna. I appreciate it. And thank you to everyone for being here. The panelists and I have had a chance to meet together a couple of times, and we are just super excited to be coming to you today and speaking with you about family peer support services. We're going to talk about family peer support services and the various roles that they play. And to kick this off, we will have each peer on the panel share on the role they play within their state. I believe that currently we have Heather with Oklahoma, we have Felicia with Texas, and we have Paula with Arkansas. And we're still waiting, I believe, for our Louisiana panelists to join us, Sabrina and Melissa, our New Mexico panelist. So hopefully, there's Melissa, yay, she made it. Okay, so as a group, one of the things that we talked about is our hope is that every state peer supports, or excuse me, parent peer supports and family partners programs would strive to create space for humanness and empathy and be culturally aware and linguistically responsible. So we're going to talk about those ideas along with the various roles that each individual plays in their state, because we know that there's a broad continuum of care and what we can and can't offer within our states. And so I, at this point, am going to go to the panelists and get them to share their experience, strength, and hope and their information with you guys. To start off with, because there is such diversity, our first question for the panelists is, what is a family peer for your state? And I'm going to kick it over to Melissa from New Mexico first.
Hello, thank you, Jamie. Really a privilege to be here on this panel with you all. So in New Mexico, I am what we call a family peer support worker, although there's also family advocates and parent partners and a variety of things in New Mexico. The thing that I see that peers and family peers have in common is we both come from that place of lived experience, and we both bring a lot of passion to our roles, and we all have sort of the same lens of unconditional support for the folks that we work with. No judgment, nothing's going to shock us. We're just going to keep on rolling. So in New Mexico, family peer support workers are people that have the lived experience of having raised a child with behavioral health, mental health, developmental delay issues. And then we do the training, and our role is to help other parents navigate the child serving systems, whether that's school, juvenile justice, treatment, residential treatment, foster care, any of those child serving systems. So standing there with that parent and helping them navigate those systems, be more engaged, have better understanding of what the systems are asking of them, and be able to move forward, and modeling that you can do this and get through it. I would say that yesterday there was some talk about how in peer world, the role is a little hard to define in some ways. I feel like peers are probably better defined than family peers, and you'll see that as we all explain what our different roles are. But I have the same concern that if family peers are not utilized for their role, then it's going to be hard to grow our area. An example I would use is somebody that I know that was hired as a family peer who was a CPSW and then utilized as a care coordinator. So as long as those kind of sort of mushing up the roles is happening, it's going to be hard for us to grow. And that's from New Mexico.
All right, well, good afternoon, everyone. And I'm like with everybody else, it's just been an honor to be on this panel. And I can say that my daughter gave me the gift of my job. So she was born April Fool's, 2 months early in the middle of a blizzard. And so I am very, very happy to say that I'm a certified family partner. And that really is the kind of the key definition that we have here in Texas. And similar to New Mexico, it does mean that you have to have or be a parent with lived experience, meaning that you have to be at least 18 and over, be available to pass a Medicaid background check. So our description is very, very clear in our Texas Administration Code. Along with, you have to have the experience of at least navigating one, if not more, of the child serving system. So having your child diagnosed with a mental health diagnosis, but also you may be involved with other systems like the Child Protective Service system, the juvenile justice system, but at least have that experience of that advocacy. Like New Mexico, you also have to take a certification training. So ours actually just increased from a 3-day training to a 5-day training, but also pass an examination. So that is really key to what we have. And I think really for us, it is all about advocacy and role modeling, but also providing that self-care and emotional support for families, because all of us started a very, very different journey. And so we need that support to help us advocate in all of those other systems. And so it's really being there, it's providing resources. One thing that we say here in Texas throughout our training is initially we do for, then we do with, and then we cheer on. And that's kind of the role that we do at, as CFPs is we really, in that beginning, sometimes families come to us and they are so confused and they don't know where to even begin. And so we may do for them, like we may help them call somebody because they need some assistance somewhere. And then that next time, as we're role modeling and providing that advocacy and parents are starting to learn their voice, they're like, okay, well, next time we're going to do it with you. And then our role at the end is just to be the biggest cheerleader that there is. So we want them to, we're just going to cheer them on because they got it. And we know that, it's hard and it's a process. And so our role is just to be there for families during that process, to help with education, to provide resources, and again, really be that emotional support, but help them find their voice. And so they can advocate on behalf of their family as best as they know how. So that's our role here in Texas.
Thank you so much, Lisa. I love that. Do for, do with, and cheer on. That's great. I'm going to go ahead and bump over to Heather in Oklahoma, and then we'll come back, Sabrina.
I am Heather in Oklahoma. I am a parent partner, PRSS, and we pretty much, like the family peers, just pretty much help people find resources. And like everybody else's live experience, my kids, a parent partner is the person that was in the DHS system, and we pretty much help everybody that's going through DHS advocate through the system, because we been there and done that, and just helping them with resources and helping them find what they need. And it helps whenever somebody's been there and done that. People open up to them better. Like I was one of the people that I didn't really understand whenever I was in the DHS system, what to do, where to go. And I had a PRSS that stepped up, and she was actually the one I listened to because she had been there. She had done that. So that to me helped me realize, hey, I can do this. She did it. And now I'm that person that helps people, helps the parents, helps them navigate through the system. So it actually helps.
Thank you, Heather. I think that's so important. I know in my own journey, it was just crucial to me to find fellow parents who had actually walked this out and had lived through the same trauma and the same reoccurring crisis over and over. And it was just a godsend to me to have other individuals who had gone before me and knew how to navigate systems that I just did not. So with that, Sabrina, is your audio working now? Nope. Nope, not yet. Okay. We're going to bounce over really quick to Paula in Arkansas, and we're going to swing back to you, Sabrina. We want to make sure we get you.
All right. So hello from Arkansas. And just want to say I'm very honored and excited about being on this panel. This is a passion of mine. I am a registered nurse and a certified biblical counselor. But most importantly, I am a parent with over 13 years of experience in having a child with a substance use disorder. And I actually lost my son, Parker, when he was 20 years old to an opioid-related overdose, a heroin overdose. And following his death, I became an activist to try to save lives and to help people that are in recovery, but also to help parents navigate the struggles of having a child with substance use disorder. There were not a lot of resources when I had a minor. It was difficult to find a place for treatment, and I just saw the need. So I founded the Parker Gill Foundation that, and I'm the executive director of that foundation, and we do help support prevention and recovery efforts in the state of Arkansas. And we are a resource for parents who have people, children, family members struggling with substance use disorder. And Arkansas does not have a formal, organized state parent peer support, but we are currently looking into that, and I'm very excited about that. We are researching and trying to get something started here. But what we do have now is a large group of parents who have lost children. Unfortunately, it's a very large group of parents that have lost children and want to do something. So several of us have started our own groups, nonprofits, and we all work together, and we work with people in recovery to get parents that are struggling, that have children that are struggling, to get them to the resources that they need, just like the other people on this panel do.
Love that, Paula. You know, and I want you to know that some people have put in the chat that they stand with you and that they are sorry to hear about your loss. Very supportive of you and the work you're doing. And, you know, that's what I think is, or what makes parent peer supports so essential, but what makes them so successful is that we have that, in our case, that mama bear, but I know a lot of dads who have stepped up too, and there's nothing like a mama on a mission or a dad on a mission for the care of their kids. Absolutely. Absolutely. So I want to, Sabrina. Oh, Sabrina, can you hear me? Okay. We're just going to keep moving along, and we're going to come back to Sabrina because I am determined to get her involved in this. So just to kind of recap that question, which I thought was really good, is you guys all agree that it's lived experience when discussing what a family peer is, whether it's Oklahoma, Louisiana, Arkansas, here in Texas, or even in Arkansas where there is no certification yet, parents are stepping up to do that job. And in New Mexico, all of us lived experience and helping with the navigation of child services and systems. And I thought it was really a good tidbit that you threw out, Melissa, whenever you said it's super important that when we're employed, either into the field or as an individual, as a peer support, that we be used in that role and not be forced to draw on maybe another certification or something that we have, that we be used as a peer support. So I think that's super important to remember moving forward. Okay, Sabrina, are you ready to roll? Is anybody hearing her, or is it just me? Okay, Sabrina, you're muted. There you go. Okay.
And Jamie, we're working on it. We're
Okay.
we're doing our best, and I'll let you know when we have it solved.
Okay, thank you so much. So
Sure.
we're going to go on to question 2. And Melissa, we're going to come back to you again. How to access services in your state? Because I know that's different for everyone.
It is different for everyone, and it is not a super straightforward answer in the state of New Mexico, unfortunately. My job is actually funded by a Systems of Care grant that CYFD got here in the state, which is Children, Youth, and Family Department. And they identified 3 counties that they wanted to bring these services up, one of which is Family Peer. So you have to actually know what agency has Family Peer and how to get a hold of them. So, you know, a big part of our job is outreach to get people to know that we're here, what we offer, how to access us. But, you know, from speaking with Felicia, Texas has got a lot more together than we do. So it all depends on where you are, which is a really sort of an unfortunate, I would really like to see a one-door approach, which Texas is much farther down the pipe on. So yeah, unfortunately, the answer is it all depends on where you are.
Okay. Another question I wanted to throw at you under this is, we had talked earlier about maybe having you discuss the difference between adolescent peer versus adult peer supports.
Well, I mean, there is youth peer, which I can't really speak to because that's not my lane. And I know New Mexico is trying to bring up youth peer, and there's some really good work being done around that. But there is a marked difference between adult peer, which typically is helping adults that have mental health or substance abuse issues get the services they need to move forward. Whereas family peer is very specific to supporting the parents of a child that has behavioral health, mental health, developmental delay issues, and substance abuse certainly can fall under that umbrella. So we're dealing with the parents. We're not dealing with the parents' issues necessarily, if you understand that difference.
I do. And so what I'd like to ask you and all the panelists to think of about this question is, when we say family peer support, so there's family members of like adult children, and then there's family members of adolescents. So do the services in New Mexico address all family, or are y'all services primarily focused on adolescent parents?
No, I mean, I've got on my caseload, I've got grandmothers, I've got, really anybody that's in that primary caregiver role. Because in New Mexico, we have a lot of grandparents raising grandkids. So it's whoever is standing in that caregiver role that is having to navigate the child serving systems. And we are there to support them and stand with them.
Okay, so y'all's is for the family members with youth.
Right. Yeah, parents, right. Whatever that looks like, whether you're auntie or grandma or mom or dad or, whoever's standing in that primary caregiver role.
Okay, thank you, Melissa.
Mm-hmm.
All right, access to services here in Texas, Felicia.
Well, I wish ours was easy peasy, even though it seems easy from the outlook. People honestly can call the United Ways, what we have here in Texas, 211. I know it may be 411 or other 11s in your local city. That is one way. That is pretty easy access, but also they can contact their local mental health authority in their area. So we have 39 and then 2 behavioral health authorities as well. So we try to make it as easy as possible because each one of them has their own 800 number, whether it's for crisis or whatever services that they may need. And so we also have a link on the Health and Human Services website. Like if an individual is saying, hey, Felicia, I live in, Wharton County. I have no idea, where my local mental health authority is. We have a map. They just put in their county, and then it automatically can show them, hey, here's the nearest local mental health authority to you, and here's how you can access services. So it's kind of easy, but just like everyone else, we still have to continue to do a better job of marketing family supports, because I think that's where there's been a lot of visibility in some areas on adult peer services, but not family support. And so we want to make sure that at any moment, if any family calls and says, hey, I need help, that they are there's an automatic connection that at least explains what the certified family partners can provide and assist with. Again, everything that we do is voluntary. So if parents say, hey, I don't want to access your services, it's like, we're okay. But we always want to have that door open, that at any moment, if you say no today, that is okay, because we're all at a different place in our journey. But if you say yes 2 weeks from now or a month from now, we're still here to help serve you. So that's what we want to do. We want to make it really visible. We believe in family choice and family voice. And so it's a great way to just say, here we are, here's what we do. If you need us, we'll be here. If not, we'll back off until you need us. But we want to, again, provide that information to say that we are going to be here for you. We are in your corner. And so we're just very fortunate that we do have, dedicated family peers to do that. And we're also, I know, our youth specialists, we have 11 youth recovery centers out there. So we're trying to get an actual certification with that program as well, but I just want to expand that and just hopefully have the opportunity to just expand, really the family peer voice on, I say from the womb to the tomb. And somebody says really throughout the lifespan. That's really what we want to do. And we want to have that availability in all service systems. So right now, we're pretty much housed in our children's mental health units for that 0 to 17. And then they transfer over. We do have a transition age youth component, but we also, when they turn 19, they trans over to adult mental health services. So our job really is to make sure that there's a continuity of care from the time they enter the system all the way through adulthood and through their lifespan. So anything that we can do to help facilitate that, that's what we're here to do.
So are the certifications in Texas then for family partners, they're currently just concentrated with the 0 to 17, and you're hoping to expand them to be
Absolutely.
Service? Okay.
Yep. So right now it's 0 to 17, and really the focus is just on the mental health side. So we are having conversations with our community, which is one really big, huge thing. If I could definitely put in a plug, if the community wants it, we will respond. And so we really want people to start advocating for what they need. And I know advocacy looks very different for different people, but we know that here in Texas, once we start to hear that roar, like when the thunder starts roaring and when the community stands up and says, hey, we need to get these in other services, we're starting to listen. So now we're starting to do certification for the youth. And now we're also starting to do certification for the substance use community. I was dealing with some individuals with brain injury earlier this week. They want a certification process and really get that family peer. So this is great timing to do that. And so, hey, let's get this thing rolling. Let's get it started. And whatever we can do to help foster this in other communities, that's what we're willing to do.
That is fantastic information. Thank you. And such a great piece to say about the advocacy, making sure that in every state, please reach out to the appropriate people. And when it's your turn to talk on the panel, if you have a number or a contact, please feel free to share that for the people that are visiting from your state. Okay, Heather, same question to you. How do we access services in Oklahoma?
Pretty much like at North Care, there's a wraparound program, and pretty much what I do is with the parent partner program is just helping the people get resources. If it's mental health or if it's substance abuse or it's DV service, I just point in the right direction, and that's pretty much. But accessing services is pretty much easy. We also have the 211. And that's a lot of the, you can pretty much call that, and it pretty much directs you pretty much to go.
Okay, great. Thank you, Heather. Paula, I know that you had shared previously that it's a little bit informal in your state, but would you like to expand on that a little bit?
Yeah, I would love to. So we don't have a formal organization for the parent peers, but what we do have is a very large peer recovery support specialist program here in our state. It's amazing. So these are peers that are in recovery, and you can access the peers several different ways in Arkansas. There we have a website, the Arkansas Drug Take Back site, and you can get into contact with people who are peers. We have peers that are in recovery employed in hospitals, law enforcement agencies all throughout the state. And so I serve on a coalition, Arkansas Peers Achieving Recovery Together. It's the APART coalition, and it's a group of peers in recovery. And I serve as the parent person on that coalition. And because of that, I am embedded in the peers. And so they often get into contact with a family member, and then we can work together to get them with a parent who can then help them. People that are working in the law enforcement, they may come into contact with someone who has overdosed, and they will give our information out. And so you can go to the Arkansas Drug Take Back site. You can go to Parker Gill Foundation. Speak Up About Drugs is another organization. And so it's an informal way to access the parent family, but we do work very closely with the Arkansas Peer Recovery Support Specialist.
Fantastic. And if you have a moment, Paula, we're fixing to jump over to Sabrina. Can you drop those in the chat so that people can access those if possible?
Sure.
Thank you. Okay, Sabrina, 2 questions for you. What is a family peer in Louisiana? And then how do we access those services?
Okay, can y'all hear me?
Yes.
Okay, to access the services, you have to send a referral, and anyone can do a referral youth, and they send it over to Choices, which is a RAP facilitator, and Choices send it over to us, which is Behavior Services of Louisiana. And we have 9 regions across the state, and we're servicing each region probably right at 200 or 300 families. And we start at the age of 5, and we stop at 21. And we offer parent support and a youth support. If they're 12 and under, they only get a parent support. And that parent support will give the parent or the guardian the tools to assist the youth in their challenges that they're having. If they're 12 and over, they get a youth support and a parent support in the home. And so when Choices send us the referral, we give it to our liaison, and our liaison goes out and do the intake on the family. So they're the first faces that the family sees when they go out and do the referral. They bring the information back, and we sit down with our supervisors, and we see who's the best fit to go inside the home. If it's a critical case, we want a strong support system to go in and support the family. And our number one goal is to keep the families together, keep the youth in the home and keep the families together. And once we put all these tools together, then it's okay. It's safe to say that they can advocate for themselves when they exit in the program.
Jamie, I think you're on mute.
Whoops. Can you hear me now? Thank you. Sabrina, what I was saying to you is that I think you're one of the only states that I've heard that offers that double support. You offer a coach to both the child and to the family member, which is fantastic. Do you guys in Louisiana offer services beyond the age? If not your organization, is there any organization that does family supports for the cradle to the grave, I think is what Felicia had said, for higher peers that maybe age out at 17 or 22, I think is what you said?
Yes, they do. We're a partner. I don't know a whole lot about that part of, but they're in together. It's called Behavior. We're with Behavior Services of Louisiana, and they own rehab services too. So their building is down the streets, and they do like a group like twice a week for the older clients. So yes, we do have that here in Louisiana.
That is fantastic. If I could ask each of the panelists, whenever you're not speaking, if you have some of those services, like I asked Paula, please drop those in the chat. Sabrina, you had a couple there that I think would be good for the individuals in Louisiana, if they could grab those out of the chat. Okay, Sabrina, I'm so glad that we could hear from you. This makes me excited. We're going to move on to the third question. What are the differences or similarities between peers and family partners, and the similarities and differences with the states in your region? So, for example, Melissa, I know that we had discussed you guys offer wraparound services versus just family peer support services.
New Mexico, under the Systems of Care grant, wraparound is one of the services that they're standing up, and you can have a family peer on a RAP team. Family peer can come in when a child has an SED, a severe emotional disturbance diagnosis, or is in range of being diagnosed. So family peer can come in earlier, whereas Wraparound requires multi-systemic engagement. So the kid has to be in special ed, have a mental health issue, maybe have juvenile justice involvement. There has to be a multi-systemic, and that's a requirement for that service. So Family Peer can actually be much more of a preventative service. We can actually, get in there early, provide the support the family needs, and really work towards keeping kids out of those higher levels of care. So we can work together, we can work separately. And New Mexico is still sort of trying to navigate how to make that all work together.
Okay, that's excellent information. Felicia, how do we look here in Texas? Do we have the same level of care? Both the
Well,
wraparound?
I think so ours looks a little bit different. I think part of it obviously starts from our lived experience. So that piece is different. There's a couple of difference in our certification processes, even to get their certification to be either a peer specialist or a certified family partner. And I really think, for our children, they are kind of labeled into a level of care system, right? And so that's kind of where we start. But I think we come at it from a different perspective, just because, hey, we're again dealing specifically with the family and not the child, whereas peers are dealing specifically with the actual person that has the experience. So those are the little bit of the differences that we have. But I think, some similarities are all of us have lived experience. It just looks different. And I think that's where sometimes where the rubber meets the road is where we have some of those things like, well, I'm a peer specialist and I'm a family peer and we're this, and we're sometimes at odds. And so our job really is to figure out, okay, well, how can we be better as a team? Because we are one team under the peer umbrella. So even though there's little small intricacies that may be different, the word peer kind of is the overarching piece that really means you have that lived experience.
Perfect. Thank you so much for that. Sabrina, to you in Louisiana, what do wraparound services look like?
Wraparound services, we have a team, and that's what I tell our families when they want the services. When I was a liaison, I would go out and explain it. I'm like, the family's in the middle, and we just here to wrap our arms around you and assist you with what you need. And so we help our families with effective communication, identifying their natural supports, coping skills, if it's budgeting, self-care. It's a wide range of things that we help them with. And so majority of it is giving them community resources. That's what they need, community resources out in the community, whether it's food supply giveaway, agencies that assist them with the bills. Our team is real good about that, is helping them identify the community resources. And again, we started at the age of 5 and on up until 21.
5 to 21, very good. That's excellent. Melissa, I had a quick question for you. If possible, can you please post resources from New Mexico in the chat box? If not, I'm sure that Jennifer will get information to all the participants at a later date. Heather, what about you and wraparound services? What does that look like for your teams?
With us, we mainly deal with the adults, like the parents going through it. I know there is wraparound services at North Care that deal with children healing and support family impacted by trauma, which we do a lot. Just getting the lived experience to help people get through whatever it's going through. I deal with a lot of DHS families that just helping them build that family back up, because a lot of kids, especially my own, had a hard time dealing with just what we went through with the system. So,
Do y'all, I'm sorry, go ahead.
So that's pretty much what, just helping the parents get back to where they were and dealing with whatever they're going through.
Do y'all have some of the same resources like Sabrina was saying, like helping families locate food or other
Yes.
necessary resources.
Yes,
Okay.
just helping them going through just whatever churches or communities, just helping them find the way with whatever we can.
Okay, perfect. Thank you. And I see that you guys are dropping some stuff into the chats, and thank y'all very much because people are asking for services in their state. Okay, how to advocate for family services in your area. Paul, I'm going to go to you first on that.
Okay. Can you elaborate on that? How to
Well,
advocate? What are you wanting?
How did you advocate for services? Because you've been a trailblazer in your state and you're creating resources where no resources exist, right? It's kind of a desert in Arkansas right now. So how did you do that? How are you working with these other families that you mentioned to create a resource database for people?
Okay. I first just stepped out and I learned as much as I could about what was going on in our state. I learned as much about the peer recovery support specialist and that organization that we have through our state, and went and collected information from different recovery providers in our state. I took that and collected that information into a document. I stepped out and started a foundation so that I would have a nonprofit that I could collect, funds and donations so that I could help other people. And then I started reaching out to people on this panel. First of all, found other states that were doing it, contacted them, got that information to people that could try to get a formal program started in our state, and just got the ball rolling there. Basically, that's what I've done. I reach out to people who might come into contact with parents. Anytime I get a chance to speak on we do a lot of recovery activities. Anytime I get a chance to speak, I do that. I put our information out there. And because of that, parents, I get into contact with them. And then when that happens, I then will contact recovery centers, because the biggest problem when you are faced with a child who has substance use disorder is, what do I do now, right? How do you handle it? And so I get the parent to get some help for themselves. I try to find agencies, Al-Anon, Celebrate Recovery, things at local churches, different types of organizations to help the parent. And I get the parent involved. I communicate with that parent. I walk alongside them just like a peer would with someone who is seeking treatment. And then I search for places for that parent to give to their child or other family member for treatment, because that's a big deal too. You don't just pick up the phone and send your child to treatment. It just doesn't happen. Once you decide and determine that they need treatment, they're ready for treatment, there is a process. So as much work that I can do for the family member in that, the better it is for the family member.
Yeah.
And I work with different, recovery treatment centers to know what they have to offer. Go and visit them. I know which ones have the best offering for persons who are seeking treatment.
I think that's one of the things that is so important when it comes to substance use disorder, family coaching, and family peer supports, is that families are in crisis. And I'm sure this is across the board for all behavioral and mental health. When your child is suffering, it's so hard to be able to determine what is the best course of action, because you just want there to be a solution, and you want there to be a solution now. Right. And so if for no other reason, that's why I think family peer supports is just critical, no matter what the issue is. So those are great ways to advocate for services. Felicia, what about in Texas? Oh, I'm sorry. Paula,
Oh,
did
yeah,
you
I
want-
just want to say the other big thing that I experienced was the stigma. So anytime I can do any work to decrease the stigma of substance use disorder, that is going to be helpful for another parent. But a parent who or a family member who determines that their child has a mental health disorder or substance use disorder, they have that stigma that they're faced with. So walking along beside them and letting them know that it is a disease, it is a disorder, and any kind of support that I can give that family member along that line to fight that stigma that they may be feeling is
Mhm.
something that I work towards as well.
Absolutely. And I have to give you a shout out from Vermilion here in Houston with Unlimited Visions. I saw her name pop up. I happen to know her and love her, and she tells you great work. She loves what you're doing for the parents. So
Thank you. Thank you, Vermilion.
So Felicia, in Texas, what is the best way to advocate for services? And if you don't mind, I'd love for each of the panelists to speak, just if you can weave it into your answer, what Paula brought up about what is it that you're doing or that your trainees do to help decrease that stigma, along with advocating for services?
Well, definitely here in Texas, there's so many different ways. And I always think of it like a role sitting on the bus. So we're all on the bus, we're maybe going to different destinations, but we're using the bus as the vehicle. And so I think the great thing about that is that regardless of whatever seat you have on the bus, there is a seat for you on the bus. And so when it comes to advocacy, everybody can do their part, but it all depends on what people are comfortable with. There's skill sets in particular areas, and then other areas, it's just, we want you to open your mouth and be vocal. The great thing about this is that what we do is family voice, and that's what we start with, voice and choice. So we need your voice to participate in things and to advocate for services. So if you're seeing something that you're like, hey, I really would like to get this therapeutic service for my child, and you're not seeing it offered, use your voice. I think there's so many different ways that people can plug in. Here in Texas, we're fortunate enough, we have organizations that even if you're new or if you've been a part, in this journey for a long time, we have Texas Family Voice Network. We partner with other organizations that also help you find your voice. There's other ways, whether you're talking about advocating at the legislative level, that's where we need huge voices right now. And we need to put things in legislations and policies. We need to get, more funding for the family peer service. We need to be able to have more Medicaid offerings for us. We don't want anybody to get turned away for any reason. And so one of the ways to do that is, how do we advocate locally, and then also on state level, but then also at the national level? So you may know who your representatives are in your local area. You may go to dinner with them, and they go to your church or whatever it is. That's the time to start having these, what we call courageous conversations. I also think just connecting with people, sharing your story, being okay to share your story. And again, sometimes that happens at different parts of our journey. That doesn't mean that you have to share your story every day. But there may be specific times where it's like, hey, I want to share my story. And then also, advocating for a livable wage. We know that the workforce is a huge issue when it comes to parent partners and peers alike. And so we want to make sure that we're providing work opportunities for family peers and peer specialists where they can make a livable wage, so we can stop kind of the reoccurring door. So that's one of the, there's several ways that people can advocate. It really is up to the individual. And again, if they need to connect with other organizations to help uplift their voice, please do so, because there's an array of resources. And I think going back to the stigma issue, we all have that kind of in what we do. People are, we don't know what that is. And, something's wrong with your child. And, as somebody already mentioned, when you talk about my child, I have, that's cool. I'm a clinician, but I'm a mama bear first. And I go into mama mode. And so that's what we do. And that's the role that we play. And so the stigma around it really is up to us to help provide that education. And what I can definitely say, it's like running a race. Sometimes we keep running laps as individuals because we're in there, we're advocating. I'm a mama, I still have to deal with some of the behaviors. I still have to deal with the service systems, and we get tired. And so what I will say is make sure that something that we teach is a part of certification training is one, make sure you have that self-care, but also make sure that you have that village that is able to help support you, and know that there's people like us that sometimes when you get weary, we're there to help uplift you and carry that baton. But what I would say is don't get discouraged, because change happens when people make it happen. And so you are the community, you are the individual within the community, you can make that change. At a state level, I tell people all the time, you know, data drives decisions and people drive decisions. So if you want things to change in your state, sometimes it's just as simple as having a conversation and the ball can get rolling. So please, please, again, don't get discouraged. Sometimes, you know, the tears may flow, the frustration may be there, but just know that if the one person doesn't listen one time, there's another one that may listen. Let's connect you to the right organization. So we're gonna dismantle the stigma, because this is every day. And so as parents, our job is to continue to go even when we don't want to. And I would say that as far as advocacy, our job is to continue to advocate. And again, if I need to pass the torch for a little while, I'm gonna pass the torch. But I want somebody to carry it now, and then I can take it back. At lap 2, I'll take it back. But carry it, uplift us, and then just be supportive of each other, because we're all in this thing together. And I think if we support each other and we continue to advocate, we will make some changes happen.
Absolutely. And I have to tell you, Felicia, the names are coming so fast, I can't read them all, but I know there was a Bob S. and a couple more that are singing your praises, telling you how fantastic you are. Here, keep saying what you're saying. And I will say that years ago, I was shocked, just to give testament to what you're saying, Felicia. I just on a whim went to Austin and agreed to speak as a parent whenever we were trying to get House Bill, I can't even remember passed, but it's the one here in Texas that we got passed for peer supports. And I just spoke, got up and left, and my representative happened to be in the room, and he got off the dais as other people were speaking and went outside and found me. And I know there's been a couple other that healthcare, mental health, and substance use are hot topics, and our legislators are interested. They do want to hear from us, and one voice does make a difference. So I encourage anyone, whatever state you're in, please don't hesitate to reach out. Your one voice does matter. Okay, so the same question. I want to go to Melissa in New Mexico. How to advocate for services in your area, and any thoughts you have on reducing stigma?
Well, I think one of the real powerful parts of peer work and family peer work is folks that are dealing with these high intensity, high needs kids often feel very siloed and alone. And when a family peer steps in and can share some of their story and can let them know that they're not the only one, they've got support, there's somebody here to help, there's somebody to stand with them as long as they need somebody to stand with them until they're ready to stand for themselves. I think that helps take away a lot of the stigma, although systems are still very stigmatizing, unfortunately. I think one of the other things that family peer brings that other aspects of the system don't necessarily bring is a understanding of the urgency that the family is dealing with. If you have just been told that your kid's going to be suspended from school for 2 weeks, or you've just been told that your kid needs a higher level of care and you don't know what that looks like, these are things you want to be able to get information about and be able to deal with rapidly. You don't want to wait a week till somebody can get back to you, or 2 weeks until there's a meeting, or, so being those people that have walked that path, we understand that urgency where other parts of the system don't necessarily. Like, I would never give a parent a resource, especially for therapy, without having first called that agency to make sure they offer the services we're looking for and understand what their wait list is. I do not like to just throw services at families like this is going to fix your problem. It's like you really have to know what's happening because they don't have time. Families that have high needs kids don't have time to be making a million calls to get to one service. So those are some of the ways that I see. And then you take that information back to the systems and say, on the ground, we're finding, there's this gap over here, there's this hole over here, this is what we're hearing from families. So I really enjoy doing the policy side of it, along with, doing that supporting families on a one-on-one, and where that can come together and move things forward for everybody is when you really hit the sweet spot.
Yes, very much so. And it was stated in the chats, and I totally agree. Great quote, stand with them until they can stand for themselves, Melissa. That's beautiful. And Felicia, voice and choice. I love that. You've got some great quotes. I hope people are writing these down. Heather, what about you whenever it comes to advocacy?
We pretty much have several speaking engagements to put out the word for about the parent partner program. We find resources and notify pretty much the child welfare system and other providers for the parents to get them in. And I myself do a lot of resources and just being there for the parents. And sometimes they just need somebody to go with them. And I know just being beside them, pushing them to do better and being their voice, because I know I at the time did not want to do the services and I was scared and I didn't know what to say. Just being that person to walk with them, like tell them it's okay, you can do this. And even if they mess up, let them know that, hey, I've been there, I've done that. And just being that voice for them, it kind of helps that parent going, okay, I got this. And sometimes we have parents that call us all the time and pretty much talk to us like, hey, I don't know what I'm doing. And we just pretty much tell them, hey, I've been there, I've done that, and I got you. And that helps them keep putting that first step forward.
Good, thank you so much. It's my understanding that we are running for an hour and 15. Is that correct? That means we have about 15 minutes left.
That's correct, Jamie.
Thank you. Okay. So Sabrina, I want to go to you with that last question before we move into the lightning round. How do you advocate for family services in your area?
My go-to is when you advocate, and if you're going to advocate, you have to have a passion to be a peer support and for the families. You have to like what you do, love what you do in order to advocate. And we have to advocate all the time for more hours. I started out as a peer support with this company and going into the homes as a parent support. And so I've done a lot of advocating. They give us an hour, hour and a half because we're on a time-based limit. And I'm like, no, we need more time. This family, I had her right here where I wanted her at. She was fixing up, open up and tell me, and our time was up. So we have to go back and we have to go to the facilitator and advocate for more time. Can you give us more time with this family? Advocating inside the school system. I had a school wanted to have one of my youth put in special education. And he didn't need to be in special education. So we had to go to the school and advocate. He brought his grades up. We got him where he needed to be. He's in the military now. He graduated. So we have to advocate in its different aspects in the community, even when they're going to pay their bills. Advocate for yourself. This is too much. You didn't use this much water. Advocate is different ways that we can show them how to advocate for themselves and to be a voice. A lot of our families' parents didn't get an education, didn't get a high school diploma. We go back and we show them how to do these applications, how to get back in school, how to go back to college so they can provide for their family. So, it's lots of ways that we can advocate for our families. But you have to have a passion. You have to love what you do in order to do it.
Absolutely. What about stigma? Do you want to address that?
Mm, with our families, with the support staff that we have, it's a lot of stigma and it's different ranges of it with each family. Each family is different. Some of the stories you wouldn't believe. We deal with DCFS a lot. We deal with foster parents a whole lot with moving the kids out of the homes. So it's, that goes both ways too with the stigma.
Yeah, good point. And Fern dropped into the chats. Awesome advocating, Sabrina. Way to go.
Thank you.
All right, ladies, the last question before we move into Q&A. We talked about challenges in the profession whenever we met previously. And Melissa, you said one thing in particular is not enough Spanish-speaking peers in New Mexico and lack of high level of support within the government, and possibly how to load services and support on the front end. Do you want to talk about those or anything else that you see as challenges in the New Mexico system?
Well, yeah, I know in New Mexico, we have very few, we have very few family peers. I think we have somewhere around 400 peers and 23 family peers. And all 23 aren't even actively working. So numbers game, we're behind. So, some of the challenges I see are that people don't necessarily understand what our role is. So if the people that in the system that are making policy decisions, that are funding things, don't really understand what you're doing, how it works, what the value is, then it's hard to grow. So there's that. In New Mexico, it's sort of this weird thing where peer sits under OPRE, which is the Office of Peer Recovery and Engagement. So there's like this whole organization just to support peer, right? For whatever reason, Family Peer sits under CYFD, which is Children, Youth, and Families Department in New Mexico, which puts us sort of in this weird position because CYFD is also the same organization that takes people's children away from them. So it's sort of a rough spot for us, but that's where we are. So, Spanish speaking peers would be of value to a lot of families. Family peers would be of value to a lot of families if we had more of them and they were easier to access. And, just this whole sort of what we need a clear definition of what the roles are. Because as long as the roles sort of get mushed up, I was on a FREDLA family peer conference earlier this year, and we had a breakout session where family peers were all talking to each other. And it was sort of like, what's the craziest thing they asked you to do in your job? And it's like, oh, we hired a family peer, you can do the janitorial, or, oh, we hired a family peer, you can drive the kids, or, oh, we had, my personal experience was my clinical director, who didn't really know what the heck to do with a family peer, said, oh, I know, you can do the bulletin board in the hall. It's like, I'm a family peer, I'm not a bulletin board creator. It actually got to the point where I went and told my supervisor, I'm changing my title from family peer to unicorn guinea pig, because it is clear to me that nobody knows what I am or what to do with me. But you just have to keep pushing forward and connecting with people that get what you're doing. And the more people you can connect with that get what you're doing and see the value in it, the more people they'll bring in. So, we're just sort of organically growing it to the best of our ability.
Thank you, Melissa. And Wayne Coleman says, Melissa is a wonderful, in all caps, gift to New Mexico families. So thank you, Melissa, for what you're doing in New Mexico.
Thank you, Wynn, family peer support advocate.
Paula, I'm going to go to you next on that. I know that when we talked earlier, this is maybe a good time for you to speak up onto what you could have used had it been around whenever you were looking for services, and the fact that there's not a structured family program in Arkansas yet.
Right. I think that yes, there's not a structured family program yet. As a mom having a minor, both of my children began their addiction while they were still in high school. And as a minor, I didn't have someone to go and help me know how to get them treatment. I was concerned that I might get, in trouble legally because, detention, not going to school, truancy. And I was reaching out all over Little Rock trying to find someone to help me help my child. And to be able to pick up the phone and have a parent partner to be able to help me navigate all of the different systems would have been an amazing help. And so that's a goal, that's a challenge that it's not there, but it's also a goal and something to strive for.
Absolutely. And I think it speaks to what Sabrina was saying earlier, just the work that they're doing in Louisiana within the school systems with their families, which is fantastic for me as a former educator. So unfortunately, I'm going to ask the three remaining panelists challenges in their profession. I know this is the worst question to do this, but I'm going to put you on like a 30-second timer. So if you could just craft your answer to about 30 seconds. And Sabrina, I'm just going to go straight back to you. Challenges in the profession. You talked about training for peer support and wraparound services.
Educating our support staff, just with me being a trainer and trying to get everybody kind of like on the same level and being passionate about it and caring. And with me being a peer support, being a liaison, and now a trainer, it's like I have to stay in the trainer's role, but they still come in. I had a support come in yesterday. It's like, I need help myself. I need therapy because of the mom found the youth journal and she was wanting to cut herself and, go on and just, until I had to just shut the door and, give this support staff, counseling and support her, in what she was going through with. So it's pretty much the support staff, keeping them and enforcing self-care. Self-care. You can't, you don't want to bring their problems home, the family, but how can you not? I mean, my prayer lists get longer and longer every night. And so, even with our families and with our support staff. So just trying to play both roles is kind of challenging.
Yeah, so true. Heather.
Pretty much just funding and having, we can give them the resources, we can tell them where to go, and them not having domestic violence shelters and beds available and having inpatient beds available. That's the biggest one of the challenges is we get them there and they can't go in because they don't have nowhere to go. So that's the biggest problem is just the funding and not be able to deal with anybody out of Oklahoma County around our area. If they move to Cleveland, or if they move to, out of the little district that we have, we can't help them.
Very good. I remember, and we don't have time to go into it, but I remember Melissa having some of the same issues in New Mexico, struggling with the same things. Felicia, we're going to wrap it up with you. You had talked about, and you mentioned it earlier, the livable wage, the recruiting process, and the diversity of funding and expanding billable services. Do you want to add to that?
I would probably say all of those, yay. But also, I would definitely say the legitimacy of our role is trying to make it legitimized. So we've done a certification process, we've got a certificate, but again, how do we make that legitimized in the community? So marketing it better, to work smarter, not harder, but partner better in our communities. To also, some of the challenges that we face here in Texas is to not have this us versus them, that family peers versus our peer specialists or versus any other entity, thinking about it as what I call it in the movie Drumline, it's one band, one sound. We all may play different instruments. I may be a flute and a trumpet or whatever. Somebody may play the drums, somebody may play the clarinet. But when we're in the community, we are peers, and that's the umbrella that we're under, but out there, they don't understand the differences. And so when we play, sometimes we are out of tune. And so we need to really work smarter together and advocate together. So when we're in the community, we can sound like one band. And I think that will be helpful as we move forward and push the agenda of advocating, because we are one team. I'm a family peer, and peer specialists are peer specialists, but we are one team. And I think that's the challenge of really having that mindset of how do we push forward and how do we, become one band and one sound.
And I think that is a beautiful way to wrap it up. That's a fantastic ending.